We are returning to the public hearings of the International Independent Commission of Inquiry on occupied Palestinian territory, including East Jerusalem, and on Israel. Our next witness is Ms. Anjli Parrin. Ms. Parrin, would you like to introduce yourself, tell us a little about yourself, and then please make an opening statement. After you've completed your statement, I may have some questions of detail or questions arising from it, and also if there are areas that you don't cover in your statement that we are interested in, I might raise those with you if necessary. But thank you very much for coming. We greatly appreciate your participation. Please introduce yourself and make your statement.
Perfect. Thank you very much. My name is Anjli Parrin, and I'm a Kenyan lawyer and clinical professor at the University of Chicago Law School, where I direct the Global Human Rights Clinic. I teach students and carry out human rights advocacy, fact-finding, and investigations around the world. My practice and research focuses on the areas of armed conflict and international criminal law, transitional justice, discrimination and inequality, and socioeconomic rights. In the context of Gaza, in partnership with the University of Chicago Medicine Department of Surgery and Trauma and the International Human Rights Program at the University of Toronto Law School, we've been researching the impacts of armed conflict on the right to health, including harms to reproductive health. Last year, we also started a partnership with Physicians for Human Rights to deepen this work. For the past 9 months, my team has interviewed healthcare workers who have spent time in Gaza to support human rights documentation efforts, advocacy, as well as public health and legal research. To date, we've conducted interviews and taken affidavits from 49 healthcare workers, as well as obtained 6,000 photos and videos, which we have verified and preserved. We've also investigated a set of specific incidents, including the damage to Basma Medical Center, which is a fertility clinic on which we published a human rights report. In order to carry out this work, our methodology consisted of, first, detailed interviews and the collection of affidavits from 2 senior clinic and management staff. Second, a review of open source information about Basma Fertility Center to understand what the clinic was like prior to October 7th. Also to look at public reporting about the attack on the facility and information about the conflict dynamics and uses of different types of weapons in Gaza at that time. We collected and reviewed photos from the relatives of the Basma Clinic's management who visited the site in January 2024. We also collected and assessed publicly available photos that were taken by journalists in 2024. We worked with 2 munitions experts, one artillery officer with 45 years of experience in combat operations and doing blast site analysis, and a second explosive remnants of war advisor with over 35 years of experience to assess the photos that we had collected. And finally, we reviewed and analyzed the relevant satellite imagery around that time. So prior to October 7th, there were approximately 9 clinics providing assisted reproductive and fertility services in Gaza, including in vitro fertilization, or IVF, which was extremely popular. The largest of these is the Basma Medical Center in Gaza City, which was founded in 1997. By 2023, it served around half of the market for IVF and also offered pre-implantation, genetic diagnosis, cryopreservation, and stored embryos and genetic samples, including from other centers across Gaza. And so prior to October 7th, 2023, Basma would generally see around 2,000 to 3,000 patients per month and conducted around 70 to 100 IVF procedures per month. The clinic is located in Gaza City on Jalal Street next to Al-Sabah Street. It operates out of a 3-story standalone building, which has a wall around it and a small garden. I'd like to show you an image of what the clinic looked like prior to the attack.
Thank you. Up there.
So as you can see here, the clinic has 2 large signs. It's also over here.
Good.
The clinic has 2 large signs on the outside of the building, one of which says Basma Medical Center in Arabic in large red letters on the right, and a second which depicts a woman and child and also says Basma Medical Center on it. And then the second picture is a picture of the interior of the building, which had facilities to carry out IVF procedures, day procedures, as well as to see clients. And so on October 7th, 2023, the clinic had around 4,000 embryos and 1,000 sperm and unfertilized egg specimens stored in 3 containers at the clinic. In order to preserve reproductive material, it's necessary to freeze and store it in containers maintained at very low temperatures using liquid nitrogen, which is periodically replenished. The liquid nitrogen is generally imported from outside of Gaza, normally from Israel or obtained from a local distributor in Gaza. Shortly after October 7th, the healthcare professionals at Al-Basma Medical Center realized that it would not be possible to continue operating. So they worked to finish as many scheduled procedures as possible, provide essential treatment to existing patients, and freeze embryos for those for whom it would not be possible to carry out implantation in time. They procured an additional 50 to 70 liters of nitrogen from a local distributor, which they expected would last another 6 to 8 weeks for the 3 containers. On October 10th, 2023, Al-Basma fully ceased active treatment, but senior staff continued to check on the facility and on the specimens daily. During one of these checks, a senior staff member noticed that the liquid nitrogen level in the containers had dropped. He contacted humanitarian organizations, but none were able to help. So failing to get sufficient nitrogen, the team took the difficult decision to consolidate the 4,000 embryos and 1,000 sperm and eggs that had been placed into the 3 containers into 1 container of 3,000 specimens. Thus, they lost 2,000 specimens. The head of the clinic told me that to make this decision was, quote, absolutely heartbreaking. It was absolutely damaging to my heart, my everything. Due to the increase in the conflict, the manager of the embryology lab, who had been carrying out daily visits to check on the facility, conducted a last checkup on the 16th of November 2023 and then fled to Rafah. When in Rafah, an Al-Basma staff was able to obtain an additional 50 liters of nitrogen. He contacted humanitarian organizations, including a UNDP operations manager, to try to get help to get safe passage of the liquid nitrogen to the clinic. However, no agencies were able to help. In early December, the Al-Basma team received news from others still in the area that the IDF was carrying out operations near to the clinic. December 12th, 2023 satellite imagery shows some type of activity in the area of the clinic. On December 20th, a relative of a clinic senior staff member attempted to visit the clinic to check on it, but he saw IDF tanks nearby and thus got scared and fled. And on January 2nd, 2024, this individual was able to return to the clinic to see that it had been significantly attacked. He started taking photos of the site and sent them to the Al-Basma management on the same day. He found that the embryology lab had been significantly destroyed. Likely due to the impact of the attack, the vacuum seals of the nitrogen containers burst and the lids opened, instantly destroying the remaining 3,000 reproductive specimens. We analyzed the images of the Al-Basma facility and consulted with 2 senior artillery and munitions experts. I'd like to show you a few of the images of some of the damage that were taken on January 2nd, 2024. So this first image is of the exterior of the building, and you can see significant damage. The next image is of the reception area, where you can also see some damage, as well as some parts of the false ceilings that seem to have been damaged. This next image is of the embryology lab, and next to the wall, you can see the nitrogen tanks. In this image, you can see 2 of the 3 nitrogen tanks that have been opened. This next image is one of the operating rooms. And this final image shows the cashier room, and you can see the entry point of munition. Although the munitions experts cautioned that it's very difficult to make conclusive findings from just imagery analysis, and that more findings would have been possible with a site visit by a trained expert, what you can see is that first, it appears that the building has come under significant and sustained direct attack, both using heavy weaponry and gunfire. There's significant destruction of the facility. The level of damage to the embryology lab in particular is consistent with heavy weaponry such as tank fire. There is no evidence of an airstrike or aerial bombs, and the roof is intact, but rather the damage is likely caused by ground-level weaponry. Fourth, the amount of damage to Al Basma would not have been caused by hand grenades alone. The photo that I showed you at the end shows a circular hole in the wall, which would be consistent with a round of tank fire, although other explanations could not fully be excluded. There's a tail fin of a mortar in the photographs, and our testimony says that these were found in the building. However, these were too small to cause the level of damage seen, and definitive findings would require on-the-ground investigation. So this is an image taken in May 2024, where you can see the full structure of the building. On the very left is the embryology lab, which had been, for which they'd seen significant damage. Above that was a flat or an apartment that belonged to the owner of the clinic. And the genetic and chemistry lab is also on this sort of third level of the building, sort of above where you see the sign of Al Basma. For many patients at Al Basma, the specimens which were destroyed represented their last opportunity to have biological children, whether due to loss of fertility because of cancer or other health reasons, or due to age. Staff at Al Basma explained that when they told clients that the biological material was lost, that many suffered significant trauma and shock, including loss of consciousness and significant emotion. Many of these patients have been repeatedly displaced, now living in tents without access to essential services. I want to share a story of just one patient which the Al Basma staff told my team about. This patient had one son who had been killed in a rocket attack in a prior war in Jabalia when he was just 16 years old. It was her only son. Aged 45, she came to Al Basma to try to have another child, and they managed to get 3 embryos. These were all lost. This is just one example of families who have not had the opportunity to have biological children. But of course, there's 5,000 other examples. There's also a larger impact on healthcare. None of Gaza's 9 IVF centers have been functional since shortly after the war began. Even in the case that Al Basma is able to be rebuilt, economic devastation means that it could be years before families are able to afford treatment again. Given the gravity of the incident, I would urge an immediate launch of an independent investigation into this attack to ensure accountability and transparency for what happened. Those who lost their genetic samples deserve fair compensation and reparations for their irreplaceable loss. Additionally, resources must be allocated to rebuild the Al Basma Clinic and other fertility clinics so that they can serve the Palestinian people in Gaza. Thanks for your attention, and I'm happy to answer any questions you might have.
Thank you very much for that, that comprehensive statement, which was very useful, and also for the photographs. Can I ask how you got the photographs?
We obtained the photographs from the management of Al Basma Clinic, whom we had interviewed. The relative of the person that we interviewed had gone and taken the photo on January 2nd and sent it to the staff member. And that staff member shared it with us and confirmed that they were all taken on January 2nd.
Right. And we saw on the photo that the name Al Basra Clinic was still there, so that any soldiers approaching it at least knew that it was a health facility. So did it just say Al Basra Clinic, or did it say more than that?
It says Al Basma Medical Center.
Medical Center.
And underneath, there's the name of the director or the owner of the center. And then so that's on the right side in large red letters. And then on the other side was a image of a woman and a child. And again, the words there said Al Basma Medical Center.
Right. So it was clearly identified for anyone who went there that it was a medical center.
Also based
although
on
it was Arabic that it was written in.
Yes. Also based on our interviews, it appears that the building in the IVF center was very well known to people in Gaza. we verified that on Google Maps, there's a healthcare sign, so the H hospital sign, where the center is located, and that continues until today.
Right. Do you know whether there has been any damage to any of the other smaller fertility clinics?
We know that there has been some damage to other clinics, but the exact nature of this we didn't investigate.
Right, so this is...
And so we focused primarily on our Basma Clinic. Those we interviewed said that other clinics had been affected, but we didn't do an investigation of those.
And you focused on Al Basma because it was the largest?
We focused on Al Basma because it was the largest, and also because it was a clinic that was holding embryos and egg and sperm from other fertility centers. So not all of the fertility centers had the capacity to store embryos, and so frequently if they carried out services, they would store it at Al Basma. And so it was of particular importance. Further, to our knowledge, this is the attack that has kind of been the largest on an IVF center.
Right. Do you consider that the Israeli soldiers, and I say that because if it was a tank shell, the only people operating tanks in Gaza are the Israeli military forces. If it was a tank shell, it must have been fired by Israeli military forces. Do you consider that they knew that it was a fertility clinic, or that they knew no more than that it was a health centre, medical centre?
So firstly, I think on our side, with the kind of the limited to the scope of investigation that we did, it wouldn't be possible for us to say definitively who it was. Certainly, you could look and analyze who had access to tank shells at that area. And I think, the consultations that we have with munitions expert make clear that the building came under direct and heavy attack. And so what they can say is it was certainly a direct attack, and it was certainly with heavy weaponry, consistent with a tank. There could be other, types of munitions used as well. It's very hard to tell without being able to go on the ground to see, for example, the fragments.
Look, so that was going to be my next question.
Okay.
What are the other options?
In this current environment, I think there's not necessarily, unfortunately, without doing a ground investigation, other options. It's very consistent with heavy weaponry. It's not light weaponry that caused this, and it's certainly not an attack on another building that would have, the impact of that would have damaged the fertility clinic. So it was a direct attack, we can say that. We can say that it was with heavy weaponry, and to the extent that we consider that only the IDF had those capabilities, I think it would be consistent that it was, an IDF attack. Whether they knew it was an IVF center or not, I think that would depend on how much research they did. If they read it, they would see that it was a medical center. If they looked at the image of a woman and a child, that might suggest that has something to do with women and children. And if they Googled it, they would know it was an IVF center, because certainly, there's lots of public information available. If they put it into Google Maps, for example, they could see very clearly that people had said they'd gone there for IVF treatment. And so it depends how much research they would have done.
Right. And in addition to that, we do know that the Israeli forces had geolocation data for all the health and medical centres in Gaza.
Yeah, I mean, we haven't looked at what the IDF had or didn't have, but, to the extent to which they had that, then yes, one could assume that they should know what it was. In their daily update, the IDF on December 16th noted that they were operating in Gaza City, and in the satellite imagery from January 20th, for which we're able to get high-resolution satellite imagery, you can see that there is a kind of tracks around the area, and sort of, something that would be consistent, again, with the use of heavy weaponry or machinery.
Okay. We have a photo of an adjoining building, which has also been hit by weaponry. Have you got that photo? It's immediately to the right of the clinic.
To the south of the clinic, it's a tall building?
Yeah, with a big hole
Yeah,
nicely circular on the first floor.
to the right of the so if you're facing the clinic, to the right, so to the south of the clinic.
I don't know directions, but
Okay, yeah, so
if you
there's,
say so.
sure. We didn't focus a lot on, we took a look at the kind of damage to nearby buildings. There is a large hole, and as you note, I think even in one of the images there, you can see on the side that there is some kind of damage to a nearby building. We tried to, we asked about what was there in the buildings next to it. And so on the north end, so the left side, if you're facing it, was a pharmacy, which was a separate building, and that seems to have been damaged. On the southern end is a large tower block, and just below the tower block was, prior to the war, was a garage, an accountant's office, and a lawyer's office. But beyond that, our focus was on healthcare facilities, and so we didn't look into kind of other attacks in that area.
That's fine. Just to explain myself, we've also looked at the nature of the attack on the adjoining building to try to find out what might have hit it, and came to the conclusion that it was a tank shell.
Okay, well.
So it just provides a consistent picture of the operations in that area.
And the damage to the Basma building is both heavy weaponry, but also there's a lot of shrapnel and what looks like gunfire. So there's also small arms, a decent amount of what looks to be small arms attacks from the photos. Of course, to know more, you would need to go on the ground.
Right. Okay. When you showed the photos of the was it the embryology?
The embryology lab.
Do your military experts consider that there was a direct attack on that lab, or that the lab was damaged as a result of damage elsewhere in the building?
So our experts say that it was difficult based on the photos to say exactly where an entry happened, but that it is certainly the entire building came under significant direct attack, and the embryology lab is the sort of particularly one of the highest damaged areas. If it's possible to just pull up image 8, I can show you where the embryology lab was. So the embryology lab is right, and this is an image from May. So the staff had actually, as you can see, there's been some covering
Yes.
of the lab. And so you can see where there is this sort of green covering with metal. That's where the embryology lab was. And if you pull up image 3, I can show you exactly how. So this, on the extreme left of the image and sort of moving out of the picture, is where the embryology lab would have been. And as you can see, the entire wall has come down. If you go to image 1, and you compare it, it's the embryology lab would have been at the kind of where the image of the woman and the child are, and that area is really significantly damaged compared to the other side.
Exactly, and that's what I'm referring to. The fact that in that last, I think what you called it, photo 8.
Yes.
Image 8, the fact that the repair work that you referred to on the left-hand side, that's what struck my attention when you showed that photo, which tends to indicate that there was a significant hole in the wall there, consistent with it having been hit by some kind of shell, whereas the rest of the floor was not. It's more shrapnel.
Yes. So what exactly hit it is hard to say. This type of damage, especially you can see all of the debris at the front of the building, could also, for example, be consistent with bulldozers and other things at the front.
Yep.
And certainly there's consistency with heavy weaponry such as a tank shell. What we know is it's unlikely to have been an aerial attack, unless it was, a aerial to surface missile or something like that, simply because the roof is intact. So this we can say it's, from the ground.
Mm-hmm. The building I was referring to that we also examined is this one here on the right-hand side. So a bit further along, there's a large circular hole in the wall.
So that's, yes, and we saw those images. That's the southern end of, not the southern end, and that's where you would have had this lawyer's office and accountant's office.
Okay. thanks.
And this area here would have been where the pharmacy was, on the extreme left of the image.
Okay. You mentioned the shock and the reaction of patients when told that the samples had all been destroyed. What's your view of the consequences for them of this destruction?
I think the consequences are devastating. For anyone around the world who's trying to have children and is unable to, or is having difficulty to, it's a uniquely challenging and often traumatic experience. Additionally, IVF is quite expensive, and so for many families, they would have put in their life savings to try to have a child. And certainly for Palestinians, the ability to have a child is extremely important. I think I would want to quote the director of Basma Clinic, who worked for 25 years in Gaza providing fertility services to Palestinian people. And he said to me, there's many of these patients who will never get children, either because they have had cancer and this was the last specimen, or because of their age and this was the last specimen, or because of atrophic testicles of their husbands. So this group will never see children. How can we compensate them? How can the international community compensate them? If you give them millions and you tell them, take this $1 million and we will allow you to have a child, they'll say, I want to be allowed to have a child. So I think it's irreplaceable. There's no amount of compensation, there's no reparations, there's nothing that can be done to undo the harm. And I think the second thing that compounds it is, 2 years, 3 years, 4 years before you can rebuild these services is everything when it comes to fertility treatment. That makes all of the difference. And so there is a whole generation of people who will be unable to have children simply because they do not have access to these services.
And what, if any, broader consequences are there for the Palestinian community in Gaza, beyond the patients themselves and their immediate families?
It's hard for me to speculate, but our broader research has looked at the impact of the armed conflict on healthcare, including kind of broader reproductive health. And what we've seen from those broader interviews is, especially with midwives or with OBGYNs, is that, people are desperate to have children. It's one of the things that allows you to bring joy amidst the conflict. We always ask them that, how are people doing when, how are your patients doing? And they're saying, childbirth is a uniquely happy moment. And so despite the conflict, there's so much happiness and joy when you have a child. And I think to take that away is particularly cruel, is particularly difficult. The director of the clinic is, I think I can say absolutely beside himself. He's unable to really look at these pictures of the devastation just because of how much it represents to the community as a whole. Every child is a gift, and I think particularly in a situation of war where people feel that they've been attacked, to take that away is I think uniquely cruel.
And can I just check with you again on the figures? You said, I think, at the time of the 7th October, there were 4,000 fertilised embryos and 1,000 frozen sperm and eggs?
Yeah, so we don't have the breakdown between the sperm and egg, but 1,000 unfertilized either sperm or egg, and 4,000 fertilized embryos.
Right.
And then there was an initial loss of 2,000.
So the embryos went to 2,000, but they retained the 1,000 sperm?
The breakdown between those, they didn't keep records. So, of this 5,000, you have 3,000 reproductive material. Quite what the breakdown was, given the urgency of the situation, they didn't keep records. But you have a remaining 3,000 embryos or sperm or eggs.
But what can be said is that whether from the first loss, when the tank was opened or split, and the second loss, a total of 4,000 fertilised embryos were destroyed.
4,000 fertilized embryos, and then, 1,000 sperm or unfertilized egg specimen. These are largely people who potentially got cancer at a very young age or some other type of illness that basically meant they would be unable to reproduce. And thus it was their last opportunity before going into treatment. Generally it wasn't people who were sort of keeping eggs or sperms simply because, they wanted to, for the most part. It was largely people who, due to some type of health issue, had to freeze their reproductive material.
Okay. I think that's all my questions. Anything we haven't covered that you wanted to highlight for me?
No, just to say thank you for looking into this issue. I think the importance to families and the communities as a whole is really hard to quantify. The impact of Basma as a space where these services could be obtained is vital. Prior to October 7th, 2023, it was extremely popular. The head of the Basma Clinic told me that often, there would be these sort of either lotteries or, the possibility to provide people with free IVF treatment, which was extremely popular for people in Gaza. And thus, I know there is a hierarchy of needs when the conflict ends, but and this might seem lower on that hierarchy, but I think I just can't stress the importance of reproductive and fertility services for people.
Yeah. Thank you very much. We'll continue straight on to the next person.